Hi guys, Dr. Walla here from Prestige Animal Hospital in Fontana, California. And today I would like to help you better understand heartworm disease in dogs. Today I have my assistant, Judy, who will be helping me out by asking some questions to hopefully help you guys understand more about the signs, prevention. Hopefully we don't have to go here, but the treatment of dog heartworm as well. So when you're ready, Judy.
Okay, Dr. Walla, what is heartworm disease and how can it affect my dog?
Heartworm disease is exactly that, a worm that lives in the heart. So people think a lot of times when they hear the word worm, oh, they're going to test it on if my dog already had a test for worms. The standard test people do is a fecal test or a poop test. And that does not detect heartworm disease. Heartworm disease is detected by a blood. And basically it's transmitted from a mosquito, and the larva from the mosquito develops into a worm which lives in the heart, hence the name heartworm disease.
Okay, and then how does my dog catch heartworms?
It definitely can't catch from mosquitoes biting the dogs.
Okay, and can dog heartworms be prevented?
Yes, they can be prevented. Very, very much so, actually. It's a completely preventable disease and a potentially fatal disease. So how they can be prevented, there's oral tablets or injectable medications that can prevent the larvae from developing into adult heartworms. And back to the other question, I said mosquitoes biting. I guess the better word would be feeding, because I don't know if they necessarily bite you, but sorry, Judy, I had to correct myself. Next question.
No problem. The more information we have, the better, right? Now, what are the signs in my dog that would indicate they may have a heartworm?
Well, you could go from mild to moderate to severe signs. So I'll start between them and kind of try to break it down the best of my ability. So a lot of dogs can go asymptomatic, which means they don't show clinical signs at the beginning of the early stages of disease. As the disease progresses, you might notice just a slight cough. As we start to get into more moderate and severe signs, sometimes when you bring them in for exam, we can hear a heart murmur. They may get enlarged liver. They may get enlarged heart. You know, they may get fluid that backs up in their lungs and the abdomen. But a more gross signs or when I say gross, the signs that you would be able to hear at home would be more like difficulty breathing, exercise intolerance. Sometimes they'd have bulging ribs because they can't catch their breath. So, you know, the most severe sign is it eventually does progress to death, unfortunately, if left untreated.
Okay, and it sounds like you covered some of the middle to late stage symptoms of heartworms. Is there anything that you would add in terms of those middle to late stage symptoms?
You know, panting at rest, you know, on top of the cough. Sometimes some dogs just pant because they can't catch their breath because their lungs have been affected as well. So that'd probably be the only other thing I would add to that.
Okay. And then what can be done to stabilize my dog's heartworm disease?
To stabilize your heartworm disease, first thing we'd have to do is confirm the stage. The other thing that we'd recommend immediately is restrict the exercise. Even though they might still want to go out, don't let them. So once you get the symptoms stabilized, then we make a treatment plan determined by physical exam and further testing on your pet. Once we do the treatment plan and testing, then we initiate, and treatment has been initiated, then we put them on a regular regimen of prevention. That being said, we can avoid all those if we start prevention and keep them on prevention as they grow.
Now, how soon should I bring my dog in to see a veterinarian for heartworm prevention? At what age do they need to start that?
We could start prevention as early as 8 weeks old, but the first testing can be done at the age of 6 months old.
Okay. And how will a veterinarian diagnose if my dog does have heartworm?
Well, we have a very simple blood test, actually, that most veterinarians run in clinic. I know at Prestige we do. It only takes about 3 drops of blood, and it takes us 15-20 minutes to get the results to see if the heartworm test is negative or positive. If that's positive, we may follow up with some other testing, such as x-rays, ultrasound of the heart, and some other blood tests, but that's the mainstay and #1 test that we start with.
Okay, now last question. Why is early detection and diagnosis of heartworms so important?
Early detection and diagnosis is important because that way we can avoid the worm burden. What the worm burden means is the number of worms that have accumulated and can cause issues. Worms, just for your knowledge too, can grow to about a foot long. Imagine a foot long worm living in a small dog's heart, and they could be hundreds of these worms. And they can be very symptomatic as they start replicating and reproducing inside the system. So early detection and diagnosis is important in the prognosis because we can avoid the eventual, most serious, severe complication of death and initiate treatment that may be more effective. But please, other than treatment, prevention, prevention, prevention. A lot of times people get overwhelmed by the first few visits and tend to overlook heartworm disease. It is important to protect your pets against this. If you have any other questions, please, regarding your dog's heartworm testing, or if you've never been on it or you have questions in regards to it, go to our website, prestigeanimalhospital.com. Give us a call. You can find our number on that website as well. And we have some good information on heartworm for our clients that we've created. So we look forward to helping you in this and hopefully helping you prevent this in your pets.